These investments will be instrumental in keeping our families and communities safe, and they will help to protect our national security by keeping the nation's service members healthy and ready to serve. New York deserves the freedom to spend time outdoors without worrying about facing serious illness from a tick bite. I will keep working with my colleagues in Congress to provide this necessary funding, and I will continue prioritizing this important research to protect the health and safety of our communities and loved ones. Good morning, everyone. Thanks for joining. As the summer begins and more New Yorkers and their families are venturing outdoors, I want to talk about the threat of Lyme disease and what I'm doing to combat it. Across the country, more than 62,000 Lyme disease cases were reported in 2022, a nearly 70% increase from the annual average reported between 2017 and 2019. A bacterial infection spread by infected deer ticks, Lyme disease, can cause symptoms that affect the nervous system, joints, skin, or heart. Nearly half of all adult deer ticks collected in New York State carry the bacteria that cause Lyme disease, and more than 16,000 cases were reported across our state in 2022. Service members and their families are at particular risk, as the vast majority of military bases are located in states where exposure to ticks and other diseases that carry is especially high. That means that tick-borne diseases also pose a threat to our military readiness and therefore to our national security. As the influence of suburban development and climate change expand tick ranges and increase the risk of tick-borne illnesses, the threat to our families, our service members, and our community only grows. But despite the serious nature of these diseases, federal research and prevention efforts have historically been underfunded. So in next year's government funding bills, I'm pushing for a total of nearly $200 million to support research and programs that address Lyme disease and other tick-borne illnesses. This includes $30 million for the CDC to further their Lyme disease and tick-borne illnesses work, another $30 million for the Kay-Hagan Tick Act, a bill passed in 2019 that requires the Department of Health and Human Services to develop a national strategy to address vector-borne diseases, including tick-borne diseases. $9 million to support the Department of Defense's tick-borne disease research program, and $130 million for Lyme and tick-borne diseases research at the NIH. These investments will be instrumental in keeping our families and communities safe, and they will help to protect our national security by keeping the nation's service members healthy and ready to serve. New York deserves the freedom to spend time outdoors without worrying about facing serious illness from a tick bite. I will keep working with my colleagues in Congress to provide this necessary funding, and I will continue prioritizing this important research to protect the health and safety of our communities and loved ones. Happy to take questions.
Hi, Senator. This is Jessica Kane from WRVO Radio. How are you?
Hi.
I'm just wondering, if you mentioned service members, is this a problem up at Fort Drum, as far as you know?
Huge problem. It's the biggest location of tick-borne illnesses is Fort Drum.
Thank you.
And that makes sense because part of the Fort Drum's location is so the 10th Mountain Division can train in rugged terrain. And anywhere a deer lives, that's where you're going to get ticks. So,
Senator Terry Frank in Jamestown.
hi.
I did want to ask, because I've had a couple of friends who have gotten Lyme disease, one just recently within the last couple of weeks, and I know that she's being treated with a strong antibiotic. Will this money, the funding, help in that regard in terms of treatments?
Yes, it'll fund research, it'll fund analysis, and the work at the DoD will also include treatments. Part of being able to combat tick-borne illnesses is to make sure the doctors understand what the symptoms are. For decades, people were not diagnosed properly. A lot of people with tick-borne illnesses were told it was all in their head. Well, in fact, it has devastating disease for your nervous system, for your joints, there could be brain injury if it's gone untreated. It's a severely debilitating disease for some of the tick-borne illnesses, like Lyme. And I've had Lyme disease. I had to do 4 months of antibiotics. It's not a fun thing, but we're getting better and better at treating it, diagnosing it and treating it. And a lot of our doctors aren't taught about it in medical school. So getting the NIH up to speed, getting our military medical professionals up to speed is essential, because diagnosing it is the most important thing.
Thank you.
Hi, Senator Alex Galt from the Watertown Times. Thanks for doing this. I wanted to ask about tick culling and your thoughts, if you support any measures that might make an impact on the volume of ticks, supporting any federal programs or federal funding for state programs that do anything to cut down on the number of ticks. I know that they've become kind of their population has exploded in recent years, especially in the North Country.
Well, part of the K-Hagen Tick Act requires the Department of Health and Human Services to develop a national strategy. And if you remember the Zika virus that was mosquito-borne, we had a national strategy to make sure we could not only, one of the treatments was to make them infertile so that they couldn't breed. So I would be very interested in any science and any strategies that would include how you make sure ticks can't breed.
Thank you.
NIH was doing interesting research, and they were using one of our labs in Saranac Lake that was trying to create vaccinations, which would be great. I mean, if you could have access to a vaccine if you want one, particularly if you're someone who lives in the Hudson Valley or lives in the woods and likes to spend time outdoors. Our dogs and our pets have tick vaccines, Lyme vaccines. I don't think it's ready for human use yet, but I really appreciated the work that the Trudeau Center was doing. I don't know if they're still doing it, but I toured the lab and saw what they were working on. Any other questions on topic? We can move to off topic then.
Senator Basil John with Nexstar. Can I ask you two off-topic questions?
Yep.
Perfect. First question that I have for you is about the Surgeon General's op-ed from earlier this week about the social media warning labels. In the op-ed, he was requesting for congressional action to help with implementation of these warning labels and also going through the testing process of what labels work, comparing it to the labels you see on alcohol and cigarettes. I just want to get your thoughts on that process. Would you be ahead with it? And do you think that this would get bipartisan support?
I fully support it, and I think it would get bipartisan support. We're very worried about our children. I thought there was an interesting story reported today about how these international criminal networks were targeting our kids, doing attacks where they would pose as young girls, solicit nude photos, then use those photos as ransom and say, we're going to publish these if you don't give us money. And one young boy, 17-year-old, just succumbed to suicide because of it. So it's harming a lot of our young people. I warned my own 16-year-old about it today. And Congress has done very little to protect our youth. I have a piece of legislation called the Data Protection Agency, which would create a federal agency to do these kinds of issues in a more robust way with better oversight, with a stronger knowledge base about how to provide oversight over platforms. And we've not voted on that yet, and it's not moved. So we have to keep trying, and I think that the Surgeon General's approach is a good step.
Perfect. And the second off-topic question that I have for you is in relation to the Farm Bill. I know that there's been a very big concern from Democrats because of the possibility of cutting funding to some of those nutrition programs like SNAP and EBT, which is heavily relied on by many people in New York. What are your thoughts on the fact that many Republicans are saying that this is a necessary cut in order to reach a bipartisan solution on the bill?
Well, I've seen a chart about where they want to put the money, and they want to exponentially increase money for everything else, for cotton, for a bunch of commodities that they don't need the money. So it's going to be a boondoggle for industries of the senators who are in charge of the committee. I have a chart. I don't know if I have it. Let me just see. I could show it to you. It's pretty outrageous. It's their proposed budget invests hundreds more millions of dollars in commodities where there's nothing for fruits and vegetables, nothing. It's pretty terrible. So we have to keep making our arguments and be as persuasive as possible.
What would the worst case scenario look like if they do manage to cut that funding?
Oh my gosh. Well, a lot of our food programs, you know, school lunch, school breakfast, summer meals doesn't get funded. Women and infants, WIC doesn't get funded. We want to expand access to SNAP to foster care kids who are at college with no place to get resources for food because they're out of their foster homes at 18. So it would be a lot of people go hungry. They want to cut SNAP benefits by $30 billion. So you could just imagine how many people will go hungry with that much of a cut.
Thank you, Senator.
Senator Terry Frank again.
Hi, Terry.
Just wanted to piggyback on that because I know the Farm Bill is coming up for reauthorization in September. You're going on summer recess here shortly. What else would you like to see passed before you take this summer break?
Well, I have a couple bills that I'm working on a bipartisan basis on right now. We just passed the defense bill, so I was really happy about that. I had a bunch of provisions in there for my cyber academy, for Aero, for different types of support for the service members. I'm still working on my bipartisan paid leave bill with Bill Cassidy from Louisiana. We're hoping to introduce that bill this month. I'm also working on a bipartisan age discrimination bill with Lindsey Graham, which is modeled after our bill that changed the workplace rules for sexual assault and harassment, allowing people to not have to do mandatory arbitration and not have to sign non-disclosure agreements. So that could get done. We're hoping to do another round of funding for the 9/11 health bill between now and the end of Congress. Let's see what else is on the docket. That's about it. Those are probably our top 3 bills that have the highest likelihood of passing.
All right. Thank you.
Anything else? Anyone else? All right. Well, thank you guys for participating. If you have any follow-ups, just ask Isha. Thank you.
Thank you.
Thank you, Senator.